Radio City presents Ask Maarga.
Smoking contains tobacco, which is the most common substance of misuse, abuse, or addiction, either in the smoking form or as gutka or snuffing, which are the smokeless forms. We at Maarga consider a person addicted to smoking if he has at least three of the following things. One, they have intense urges to smoke and they cannot control it even in the places where smoking is not allowed. They continue to smoke even when they are sick on bed with fever. They want to go and have a smoke. Stopping smoking causes severe problems like irritability, at times tremors, and then restlessness. Most of the life is about having another smoke, thinking about smoking, and the most important thing is you want to go on the number of cigarettes every day because you are no longer getting the same kick that you are getting previously. Two important things to keep in mind: how soon after getting up you want to smoke a cigarette, and how many cigarettes are you smoking in a day. If the answer to both are there in your mind and you think you need help, come to Maarga. Nicotine is one of the many chemicals present in tobacco, which per se is not as harmful as the other chemicals. We have now identified up to 70 chemicals which are known to cause cancer, called as carcinogens. But nicotine is the reason why person gets addicted to smoking. It works on the brain receptors, leading to release of dopamine, which makes the person feel high, and thus person gets addicted to smoking. What is important about smoking is people think, okay, I have been smoking for 10 years, what is the point of leaving it now? But most of the changes are reversible. The changes start happening as early as within 20 minutes, and it is said within 5 to 15 years your risk of getting stroke, a heart attack, getting lung cancer are almost similar to a person who never smoked. So it is the right time to think to quit smoking. Most important thing is making up the mind. You have to be motivated to quit the smoke. If you are not, then consider seeking knowledge from various medical people as what are the side effects of smoking. Change your attitude. All our celebrities are smoking. In movie it is shown as a big thing. It is a style quotient in my college to smoke. No, they are not the right attitudes. And then practice staying away from smoking, for which you can seek help if you are finding it difficult. Withdrawal symptoms of smoking are not myth. People can have psychological symptoms like restlessness, anxiety, depression, irritability, to physical symptoms like tremors and at times even constipation, secondary to stopping smoking. The important thing to consider to handle these are: one, to not to be hungry, not to get angry, not to feel lonely, and not to feel tired. When all these are taken care of, the craving for cigarette comes down. You can also follow 5 Ds. First, importantly, delay. If you are delaying intake of cigarettes and not saying yourself, I will never smoke, that can be an efficient strategy. Deep breathe. Drink water or any liquid. Discuss importantly with family members, with friends, as how do you want to stop smoking. The last one, distracting yourself, having things to engage like physical activity or mental creativity, painting, singing, listening to music, dancing, yoga. Any of them can help you to manage with the withdrawal symptoms of smoking. We also have nicotine replacement therapies where the nicotine, the most addictive substance, is supplemented, as I was telling, which is not the most harmful substance, in controlled fashion, either as chewing gums or as patches. At Maarga, we follow nicotine replacement therapy along with evaluation for comorbidities which might lead to addiction to smoking, and managing which can help you quit smoking.
Radio City presents Ask Maarga.